Hi guys, I'm Trish. This is my fetish. Look at this. I love silly t-shirts and it's Christmas, so I'm allowed to. This is an update. Look at this. Do you see that bruise? Oh, I got knocked out, lost a tooth at the dentist. If you watch my last video, you'll see, I'll pop it up wherever I pop it up. I had to have a tooth out down here somewhere, and I was extremely stressed about it. It's all done now. It's Friday today. I had the tooth out on Monday. Everything went well. I mean, and I know I'm bruised here, but that's, I don't know, maybe, I don't think I've ever seen anyone else who's been bruised after having a tooth out, but I think it's like a normal, like a level of normal that can happen. I don't know if you can see, I've got some little marks out there. I had 2 or 3 little marks, like little lines out the side there. I'll pop up a photo of a couple of days ago when it was more obvious. Had a bit of a Joker look going on. I know, I'd say it was just because I was under a general anaesthetic and they had to get into my mouth. My jaw is still sore all the way up into here, like really quite sore. I've had no pain where the extraction was. I've been sore in the tooth in front of the tooth I had taken out. But other than that, it's just been the jaw soreness, and I had a bit of a sore throat as well for a couple of days. That's fine now. It felt... Yeah, no, it's fine now. Up until yesterday, it just felt like, you know, when you want to cry, but you don't want to cry. So you're trying to hold your cries in, and you just get that real tightness in your throat, and it really hurts. That's what it felt like for a few days. Mainly positional, like if I was like looking up or whatever. So I just avoided doing that. Everything seems to have gone well, and I think these lines that I had out here were just because they would have, because I was under a general, and because I have problems with reflux, they intubated me as well. So I would have had probably like a breathing tube out here, so they would have had to like hold my mouth open on this side. They would have used clamps or something. And these bruises, I don't know what they might have been from like when they were like pulling the tooth out. They may have had to put traction on, or like pressure on here to be able to pull the tooth out. I don't know. It's not even sore. And that bruise didn't pop out till the second day, I don't think. I've ended up with a stitch in the gum, in the tooth in front. That tooth is still there, but there's a stitch there, and I can't see if there's 1 or 2 stitches in the, what's it called, the socket. They must have taken some brains out as well. I can't tell if there's 1 or 2 stitches in the socket, because there's 2 stitches like sticking straight up, but it might be like the 2 ends of the 1 stitch. So I've got at least 2 stitches. The stitches aren't bothering me. I can feel the stitch here because it's like between my cheek and my gum, but it's not bothering me. And the ones in the socket aren't bothering me because I'm not sticking my tongue in the hole. I don't want to stick. I've done it a couple of times by accident. It's revolting. It's revolting, and it looks revolting. So anyway, the extraction went fine. I was extremely anxious when I went into the hospital. Extremely anxious. Did not shed a single tear. Not because I didn't want to, but because if I started, it would have snowballed. I would have been hysterical, and that was not going to do anyone any favours. But I almost did. Strangely, not when I was talking to any of the nurses or the anaesthetist or the surgeon or anyone else in the hospital, but when I first went in, I had to go to reception and like book in. Then I almost cried, but I just sat down with this poor receptionist lady who is not medical at all. She's just a receptionist. I don't mean just a receptionist, but I mean she's not medical. And I thought, just in case I start crying, because I really felt like I was going to start crying, I said to her, I'm sorry if I start crying. It's very difficult for me to be here. And she said, no, that's fine, dear, I understand. yeah, so I got in there at about 7:45 in the morning. They had to send me for an OPG because it had been more than 12 months since my last one. An OPG is a dental x-ray that does like all your teeth all the way around. And they wanted to do that because of the infection, they wanted to make sure that the infection hadn't spread to any other teeth. Because they said if it had, they would rather, and it would be better for me as well, if I needed more teeth taken out, to have them all done in one hit. And I'm thinking, great, I've come in here to get one tooth out, I might lose more, but it was fine. The infection hadn't spread to the other teeth. Now I'm not sure why I've got a stitch in the gum in the tooth in front. All I can think is maybe they had to, well, obviously they've cut down there, but I don't know if they've cut down there to make it easier to get the tooth out, because they actually did get it out in one piece, or if there was infection in the gum there and they've had to lance it. I don't know. And the two teeth behind, they looked a bit, I don't know, not like they'd been cut and there was no stitches, but they looked a bit traumatized there. And I've had some really gross stuff going on with those teeth since the surgery, which I'll go into. So yeah, so all my other teeth were fine. I saw my tooth. I asked the surgeon if I could see the tooth, because he came in when I was waiting in the waiting room. And I said to him, oh, can I see my tooth when you take it out? And he said, yeah. He said, it'll be in a few pieces. And I thought, oh, I didn't need that information. You just say yes. I don't need to know that you're going to be sawing my tooth into pieces. But, which a part of me did know that might have happened anyway, but I didn't like consciously want to know it. But as it turns out, he got it out in one piece, because it was a fairly straight tooth. I don't think I've got an OPG here. If I've got an OPG here in my records, I'll try to take a photo of the tooth so you can see, and I'll pop it up. One of the roots is pretty straight and the other root was just slightly bent. It's just slightly bent, so I don't think they would have had any trouble. Well, they obviously, they did have a bit of trouble getting it out, didn't they? So yeah, that was fine. When I woke up, I did have some opioids during the surgery because my anaesthetist used fentanyl as an induction with the propofol to get me off to sleep. I don't like fentanyl, but she assured me that it would most likely have worn off by the time I woke up, because she said it lasts for about half an hour and she expected me to be under for about an hour, like all up. Didn't take them an hour to get the tooth out, but you know, like by the time they put you under and they prep you and then take it out and then they stitch you up and all the rest of it, it would have been about an hour. So she used fentanyl to pop me off to sleep. I don't like fentanyl because it makes me hallucinate and it depresses my breathing when I fall asleep. So I didn't want to wake up feeling like I couldn't breathe. She also had to use a muscle relaxant, which does make me anxious because I have woken up from another general anaesthetic where they got the timing of the muscle relaxant and waking me up off. So when I woke up, I felt like I couldn't move, I couldn't speak, I couldn't open my eyes, and I felt like I couldn't breathe. I had to really concentrate on breathing. And that's just because the muscle relaxant hadn't worn off properly before I actually woke up. When I did wake up, this was a first in all the surgeries I've had, and I think I've had about 19 or 20 surgeries, which is just way too fucking many. For the second time with a general anaesthetic, I dreamed. It wasn't a nice dream. It wasn't a nightmare, but it was one of those dreams where you have, that's quite stressful, and then when you wake up and you realise it was a dream, you're like, oh, thank God that was a dream. I don't need to worry about that anymore. It was just one of those dreams. So I was dreaming and they woke me up because the anaesthetist was saying, as I was coming out of consciousness, she was saying, it's okay, Patrice, we're just going to remove your breathing tube now. And I don't know why that bothered me, because I've had tubes down my throat before while I've been awake, and it is unpleasant, but it's not the end of the world. It's not painful or anything like that, but it is unpleasant. So when I've heard that, oh, Patrice, we're just going to remove the breathing tube now. We just need you to give a bit of a cough. In my head, I've gone, no, we're not. That's not happening. Because I'm thinking, I'm not ready for that. You can just leave that fucking breathing tube in there, put me back under, and then take it out. But I mean, it doesn't work like that. So then they repeated it. They said it again, and I thought, okay, well, here we go. So you have a bit of a cough. And I don't actually remember the breathing tube coming out. I just remember gagging. So there was certainly, if that happened again, I wouldn't like it, but it's not the end of the world. It was just unpleasant. So then I woke up and they hadn't given me any further opioids for pain relief, but they did numb me up. I was numb from about here, down my chin, all the way up there, until the following morning, actually. It was a really good numbing. So I had jaw pain, and I was in like a little bit of pain, but they'd given me Panadol in the IV before they woke me up. So I just waited 6 hours before I had more Panadol, and I had some ibuprofen. They gave me Endone to take home. I haven't had any of it. I filled the script just in case, but I've only had Panadol and ibuprofen since then. Yesterday or the day before, I can't remember, but I went out to the shops and stuff. Must have been the day before yesterday. And I was quite sore. I was really quite sore in my jaw, and I thought I'll have some Panadol and I'll have some ibuprofen. I think I was due to have them in an hour or something, and I thought if the pain doesn't settle when I take those, I'm going to have some Endone, but the pain settled, so it was fine. I've been sleeping okay. I slept on that side on the first night. I wasn't allowed to brush my teeth or rinse my mouth for the first 24 hours, which is it's just revolting to not even be allowed to rinse your mouth. I had fluids only for the first 24 hours. Oh, when I say fluids and yogurt. I had some yogurt, soup, chai lattes, water. I think that's all I had. I wasn't particularly hungry. Now I have progressed to like more mushy foods. Like last night I made some mashed potato with onion and carrots and just put in, like lots of butter and some nutmeg and stuff. And the carrots I had to actually chew the carrots, but I'm chewing them on the other side. I'm not allowed to use a straw, shouldn't be having caffeine, which I don't have caffeine anyway, although there's probably a bit of caffeine in my chai lattes. No soft drinks, which I don't have. What else? No smoking. I don't smoke. I haven't smoked for 30 years. From the second day, I was allowed to rinse with warm, salty water. So I have been doing that probably, in all honesty, 5 or 6 times a day. Like whenever I eat, I go and I rinse with the warm, salty water. In the first thing in the morning before I go to bed. I didn't brush my teeth until Wednesday night because I was just honestly too fucking anxious to. I was just too anxious to put a toothbrush in my mouth, but I was doing the salt water. And when you do the salt water, because you're not allowed to spit and you're not allowed to like really swish it around because that can dislodge the clot. And you don't want to dislodge the clot. If you dislodge the clot, you can get dry socket, and I do not want dry socket. It's apparently extremely, extremely painful. So my blood clot is still in there. I've been checking it every day. As revolting as it is. And when I say revolting, I mean revolting. The first time when I looked in my mouth, because I wasn't able to do any of this research before having this done, I expected that there would just be like a big gaping hole with a like a nice dark red blood clot in it. That is not what it looks like. No. And I am not going to post a photo. I can't. I have shown every other part of my body, but I am not going to show you this revolting hole in my mouth. It is black and like a whitish grey, and no one wants to see that when they look in their mouth, in their fucking mouth. It's revolting. So, but I'm keeping an eye on it to make sure that, make sure the clot's still there and there's no infection and all that sort of thing. So what was I saying? Oh yeah, with rinsing with the salt water, I just put a teaspoon in a glass of warm water, and as I said, you don't swish it around and you don't spit, right? You just hold it in your mouth and just tip your head around, just let it swish around. Now my back two teeth here were starting to look really revolting. Now I'm not sure if it was from not brushing, or if it was from the salt water, or if it was from some trauma from the surgery. I think it might have just been some trauma from the surgery and a bit of granulation tissue, because granulation tissue, I have learned, is white when it's in your mouth. Because I had the same thing in front of the tooth in front. The gums went white, right? Just like this build-up of white crap that just looked like pus. It was so fucking revolting. And it was on the outside of these two teeth as well. I think it must have been from the surgery. So now when I've been rinsing, because those teeth are quite sort of tight in against my cheek, I like pinch my cheek out when I'm like swishing so that the salt water can actually get in there. As I said, I brushed my teeth on Wednesday night and I was just about sick doing it. I flossed like all these teeth, but I didn't, from the middle here, I didn't floss any there, and I didn't brush any there. The first time I brushed them on the Wednesday night, I used a baby brush, and I didn't use toothpaste. You're not supposed to use toothpaste until at least 3 or 4 days after. But I gave them a really, really thorough brush with the baby toothbrush. Yesterday was the Thursday. I used toothpaste yesterday, and I brushed down to here as well, but like really avoided that socket area. And I brushed those two teeth, but I avoided like the gum, because I just wasn't sure if it was the right thing to like brush that, if it was like surgical healing. I didn't want to like brush off any granulation tissue if that's what it was. And then when I brushed my teeth again last night, being very, very careful, and flossed. So when I got up this morning, I finally feel like I've like cleaned my mouth properly. I flossed all the way down to like that last tooth, and I flossed in between those back two teeth, and I got my baby toothbrush and I used it to brush these teeth right up to there, but I like brushed all around that tooth and the gums, because you know you're supposed to brush your gums when you brush your teeth as well. Brushed down there, which meant I brushed over the stitch, which didn't hurt, and I was very, very, very gentle, but I just couldn't brush on that side of the tooth that is against the empty socket. And I did the same on those back two teeth, brushed around all the surfaces, but not the surface that went onto the socket. And I brushed down very, very, very gently on the gums, and all the white crap has come off. And then I just used my regular electric toothbrush to brush all the rest of my teeth very, very, very thoroughly, and it felt so good. But I'll still do the salt water rinse, and I'll, you know, keep brushing my teeth like that for the foreseeable future. I can't find any information on exactly when I can brush that socket, but I'm not going to brush it until it's healed over, and then I'll be extremely gentle. Apparently it should be healed over within a week or 2 weeks. There's just so much conflicting information everywhere, and in the hospital I was given conflicting information of, you know, when I could brush my teeth, when I could brush the socket, when I could eat normal foods and everything. So today I'm going to try some harder food, but only chewing on this side. And when I say harder, I don't even know what I'll get, but I don't know. Nothing crunchy, and I'm not allowed to have any seeds or nuts or like anything grainy or rice or anything that could get stuck in the socket. So I'm following all those rules so that I heal properly, because, well, number one, I want to heal properly, and I don't want infections, and I don't want to cause any more problems, and I certainly don't want to have to go back to the dentist again. But today's Friday, Christmas is on Sunday, and I want to eat cheese. So that is my aim. Even if that is all I can eat on Christmas Day is cheese, I will be a happy woman. That's all I want. I won't be drinking any alcohol for another week and a half, at least until it's really well healed. But that's no big deal. I can live without that. I'm taking a very, very, very strong antibiotic, which you shouldn't drink alcohol with anyway. And I think that's it. I'm a very brave girl going and getting this tooth out. But I think it's a bit of a, you know, I said confrontation therapy or something in my last video. It's not confrontation therapy, it's exposure therapy. I think it has been really good for me because, you know, like I faced down something really, really terrifying for me with my tooth, and it's okay. And you've probably noticed with me talking on the video that you can't even see that tooth is gone. My smile hasn't changed. So, you know, they're just, you know, like pure vanity, but, you know, that is part of it for me. I don't feel like my face has changed. I might have a bit of swelling through here, and from the reading that I've been able to do since I had the tooth out, I will have some, like, jawbone loss. It will deteriorate over time if I don't get an implant, and it's highly unlikely that I'll be able to afford an implant, so that might change the shape of my jaw line of my face on that side in about 12 months time. You know, I'll face that when I come to it if I have to. That's all. I think that's it. That's my adventure with having my tooth out and being brave. That's all. I'll update you if anything changes, like as it heals and, you know, all that sort of stuff. And I can't talk anymore now because my jaw's hurting. It hurts to talk. Just look at that bruise. So, some dickhead got up this morning, feeling pretty good, not really any pain to speak of, and so went, let's go to the shops 2 days before Christmas and get all the last of the Christmas lunch stuffs that I need to get, which I had to do either today or tomorrow anyway. Just, you know, like all the stuff that you have to leave to the last minute, so like fresh fruit and, you know, deli meats and olives and, or probably could have got them earlier, you know, just sun-dried tomatoes, all that sort of stuff that you can't sort of get the week before. It was absolute madness at the shops. It took me, I don't even know how long it took me to even just get out of the car park. So I was sitting in the car park, I don't know, at least half an hour, and I could feel my face, so like, just like the whole side of my face, everywhere. The whole lot just throbbing and feeling like it's swollen. I don't know if it's swollen, I didn't look, I just got the ice on it. I brought some ice packs home from the hospital, but I left them in my sister's freezer. So now, my mouth feels so swollen, I feel like I'm talking funny. So I've just crushed up some ice and put it in a Ziploc baggie and wrapped it in a hanky, and I've got the, you know, the thing to keep it on my face, thank goodness. And it's still a little over an hour before I can have more Panadol and ibuprofen. And I'm really not a big fan of taking painkillers, that like strong painkillers. So I don't want to take endone. I really don't want to take endone. So I'm just going to get through the next hour with the ice pack and then take some Panadol and ibuprofen, and hopefully it all settles down so I don't have to take endone. And I'm going to go and make myself an Optifast mocha caramel frappe. I found some Optifast in the cupboard, so they're good because I'm on fluids. It helps me to get my protein in. So I'm going to make up and thankfully I love Optifast. I'm going to make up a chocolate Optifast shake and put in some ice, a lot of ice. I'm going to crush up some ice and blend it so it goes like a frappe. Teaspoon of decaf coffee and some sugar-free caramel syrup from Gloria Jean's, which I really, really like. And I don't know, this looks a little bit weird on there. I don't know, maybe I've probably fucked up the lighting, but anyway, just deal with it. But I wanted to just quickly jump back on as well, apart from this bullshit. When in the video earlier, I was talking about when I've been rinsing my mouth and I'm not allowed to spit. I'm not spitting, but I am not swallowing. You can't be swallowing that much salt water every day. So I just let it run out of my mouth, which is absolutely 1,000,000% revolting, absolutely revolting. So like I let it like go around in my mouth, and then I just let it run out, and it just runs down my chin into the sink, and of course there's all saliva with it and everything. But it's good as well, because I can like have a look in the sink and see if I'm like rinsing out anything yucky, which I haven't yet. So that's it. I just didn't want people thinking that I was swallowing all that salty water, because I'm not. And I've also been trying really hard to not cough, and I woke up from the surgery with a bit of a cough, because coughing can dislodge the clot. Sneezing can dislodge the clot. But I've only sneezed once since the surgery, and the cough only lasted for a day or two. So that's it. I'm going to, can you, I can't see it on that angle. Can you see that couch over there? See, that's my cushion, and that's all my cross stitch and stuff. That's where I am for the rest of the day, doing absolutely nothing. I'm going to drink my Optifast frappe. I'm going to have some mashed potatoes later. I've got some snow pea and mint and zucchini soup there for later. I'll have that, and that's it. I'm over there, and I'll make up the platters for Christmas tomorrow, and then go to my kids' house and they can look after me. Oh, and everyone, have a Merry Christmas. If I get this up before Christmas and you watch it before Christmas, Merry Christmas and stay safe. Hope Santa brings you lots and lots of cool things, but mostly love.